இறைவனுக்கு முதற் வணக்கம். தமிழ்நாடு நர்சிங், world's largest nursing career website for all our nursing needs and all job updates at NRTAMILNADU NURSING. வணக்கம் என் இனிய அன்பார்ந்த பார்வையாளர்களே, இது நமது தமிழ்நாடு நர்சிங் யூடியூப் செயலியில் உள்ளே சென்று மேலே தேடுதல் அடையாள சின்னம் ஒன்றிருக்கும். அதை அழுத்தியவுடன் என்ஆர் தமிழ்நாடு நர்சிங் அல்லது தமிழ்நாடு நர்சிங் என்று தேடுங்கள். நமது தமிழ்நாடு நர்சிங் அலைவரிசையின் அடையாள புகைப்படம் ஒன்று தெரியும். அதை அழுத்துங்கள். அதை அழுத்தியவுடனே நமது யூடியூப் பக்கத்தில் செல்லலாம். அன்புடன் வரவேற்கிறோம். யூடியூப் பக்கத்தின் தமிழ்நாடு நர்சிங். இதற்கீழே சிவப்பு பொத்தான் இருக்கும். அதை அழுத்துங்கள். இல்லை என்றால் நீங்கள் பார்த்து கொண்டிருக்கும் நமது தமிழ்நாடு நர்சிங் காணொளி கீழே உள்ள பொத்தான், சிவப்பு பொத்தானை அழுத்துங்கள். அதை அழுத்தியவுடனே பக்கத்தில் மணி சின்னம் தெரியும். அதை அழுத்துங்கள். நாங்கள் பதிவேற்றம் செய்யப்படும் அனைத்து காணொளிகளும் உங்களை தேடி வரும். இதில் செவிலியர்களை பற்றி, வேலைவாய்ப்புகளை பற்றி மற்றும் எமக்கு பிடித்தவைகளை பதிவேற்றம் செய்வோம். நன்றி. வாருங்கள் காணொளி. Welcome to learning disease condition on bronchitis. This is the respiratory system of anatomy and physiology. Overview of anatomy and physiology. Respiratory system. Respiratory system is a vital role and the trillions of cells in the body records an abundant and continuous supply of oxygen to carry out their vital function. We can't do without oxygen for even a little while as we can without food or water. Anatomy of respiratory system. Parts of respiratory system. Nose, pharynx, larynx, trachea, main bronchi, lungs, the respiratory membrane, physiology of respiratory system. Respiration, mechanism of breathing, respiratory volumes and capacity, respiratory sounds, respiration, gas transport, internal respiration, controls of respiration. Functions, additional oxygen supply. The job of respiratory system is to keep the body constantly supplied with oxygen. Elimination. Elimination of carbon dioxide, CO2. Gas exchange. The respiratory system organs oversee the gas exchange that occur between the blood and the external environment. Passageway. Passageway that allow the air to reach the lungs. Humidifier. Purify, humidify and warm incoming air. These all Overview of anatomy and physiology. Now disease condition. Now we can see about disease condition on bronchitis, bronchitis. Definition of bronchitis. It is defined as the inflammation of bronchi and bronchioles in lower respiratory tract and caused by the inhaled pathogen and smoke. Types of bronchitis. It is mainly two branches. Acute bronchitis, it is short term, and then second, chronic bronchitis, it is a long term. Acute bronchitis is an acute inflammation of the bronchi and caused by infection with virus, rhinovirus, influenza, bacteria, streptococcus, pneumonia, haemophilus, and influenza. Chronic bronchitis. This is characterized by the presence of chronic productive mucus secretion, cough, exposed to active smoker, passive smoker, exposed to chemical dust, pollen grains, and air pollution, and then infection. Pathophysiology of bronchitis. Due to etiological causes, enter into nasal pathway of respiratory tract, virus or bacteria. Disturbance of inhaled and exhale process leads to blockage of airway pattern, leads to increased of mucus secretion of lower respiratory tract, leads to infection or inflammation of the bronchitis, and that means bronchi and bronchioles. Leads to acute bronchitis, leads to chronic bronchitis, leads to bronchitis. This is definition, types, and pathophysiology. Now we see simple pathophysiology and clinical manifestation, diagnostic, and management. Simple pathophysiology. Pathophysiology of bronchitis. Due to etiological causes, leads to inflammation of bronchial wall, leads to developing signs and symptoms such as cough, fever, mucus secretion, and shortness of breathing or SOB. Leads to bronchitis, leads to acute bronchitis, leads to chronic bronchitis. That's it. We'll see clinical features of bronchitis. It is a signs and symptoms, otherwise called clinical features. First one, difficulty in breathing, shortness of breathing, fever, anorexia, malaise, insomnia, chest tightness, headache, chronic productive cough, chest pain, fatigue, weakness, and the last one, wheeze, is an abnormal breathing sound. Then we see diagnostic evaluation of bronchitis. How to diagnose the bronchitis? It is nothing but just take history collection, the full detail, mainly past medical history, family history, personal history, and also socioeconomic status. Then physical examination, respiratory examination, breathing mechanism in working, and full head to foot examination, CBC, complete blood count, it's RBC, WBC, everything. That is a complete blood count. And then pulmonary test, mainly how the pulmonary function is. Then APG analysis. APG is a atrial blood gases. And then chest X-ray to differentiate from bronchitis or pneumonia. Sputum culture, mainly color of sputum. Then throat swab. We will see next medical management of bronchitis. In the medical management of bronchitis, symptomatic treatment, complete pulmonary rehabilitation, inhaled corticosteroid due to reduce the inflammation and edema in the respiratory epithelium. Supplement oxygen, it's a administration of oxygen. Then chest physiotherapy, then nebulization therapy. Pharmacology management of bronchitis. In this pharmacology, mainly antibiotic therapy for bacterial infection, bronchodilator, injection salbutamol, antipyretics, tablet or injection, paracetamol, acetaminophen, corticosteroids, hydrocorticosteroids, hydrocortisone. Then nursing of bronchitis. This is nursing management. Professional rapport to client and family. Provide psychological support. Maintain relaxation of client in the first visiting and emergency. Assess the client history and physical condition and begin IV therapy. Assess any allergic reaction. Effective explanation to the client and the family before doing the procedure. Provide comfortable position and advice. It is based on the client condition. Provide ventilation, the proper ventilation. Monitor the vital sign. Monitor the intake and output chart. Provide pulse oximetry. Assist and instruct the client. This is not only, it also include, it is based on the client condition. Then nursing diagnosis of bronchitis. So main thing, ineffective breathing pattern and then ineffective airway pattern. The last, acute pain. These are the main nursing diagnosis of bronchitis. Viewers, thank you for your patience and watching our Tamilnadu nursing video. This video is overview of that content. I hope this video is a small information on your particular topic. This is not adequate information for your examination, so that you should read more things on your books and read it well. If you interested, hit the like button and share with your friends and circle. Don't forget to subscribe our more Tamilnadu nursing video. Any doubts, please comment below. Thank you. சிறிய தகவல் தான், நன்றாக படியுங்கள் உங்கள் புத்தகத்தில். நன்றி, சந்திப்போம் மீண்டும்.